Hey there, future nurse leaders. Welcome back to Trivi Krima HD channel, Health and Disease, your one-stop spot for nursing tips, skills, and success. Today, we're talking about a powerful communication tool that can literally save lives, SBAR. If you're in healthcare, you need to know this. Bellhop bell. Don't forget to hit that subscribe button and give this video a thumbs up if you find it helpful. Woman health worker. Let's start with the basics. What is SBAR? Speaking head. SBAR stands for S. Situation. B. Background. A. Assessment. R. Recommendation. It's a standardized way to communicate critical information, especially when time matters, like during shift reports, emergency calls to doctors, or handovers in busy hospital settings. Light bulb. SBAR helps healthcare professionals stay focused, clear, and confident when communicating important updates about a patient. S. Situation. Speaking head. Start by stating who you are, where you're calling from, and what's going on with the patient right now. Pushpin example. Hi, this is Nurse Maya from ICU Room 7. I'm calling about Mr. James, a 65-year-old who just developed shortness of breath, and his oxygen saturation has dropped to 82%. B. Background. Speaking head. Next, give relevant background about the patient that helps the receiver understand the context. Pushpin example. He was admitted 2 days ago for pneumonia. He's on IV antibiotics, has a history of COPD, and was stable until an hour ago. Assessment. Speaking head. Then, share what you think is happening based on your assessment. Pushpin example. I think he's having a worsening of his respiratory condition, possibly fluid overload or a new infection. R. Recommendation. Speaking head. Finally, make a clear request or suggest what you need. Pushpin example. I recommend starting him on oxygen via non-rebreather mask, and I think he may need a stat chest x-ray or respiratory consult. Would you like to come and assess him? Party popper, and that's it. SBAR might be simple, but it's a total game changer for safe and effective nurse communication. Health worker, have you used SBAR in clinicals or work yet? Drop your experience in the comments below. I'd love to hear how it helped you. Loudspeaker, don't forget to like, share, and subscribe for more real-life nursing tips every week. And hey, ring that notification bell so you never miss a new video.